everyone and welcome to another informative video. Today we are going to discuss into a topic that affects many people and touches the life of countless individuals and families. That is dementia. So let's first understand what is dementia. So dementia, it is a general term that represents a group of diseases and illnesses that affect your thinking, memory, reasoning, personality, mood and behavior. So the decline in mental function interferes with your daily life and activities. So it is estimated that about 50% of people aged 85 and older, they have dementia. So a person with dementia has two or more of these specific difficulties, including a decline in their memory, reasoning, language, coordination, mood and behavior. Now let's talk about types of dementia. So dementia can be divided into three groups. Number one, primary, that is diseases and conditions in which dementia is the main illness. Number two, secondary, which means dementia due to another disease or condition. And number three, reversible dementia, like symptoms such as caused by other illness or causes. So let's discuss each one by one. Let's first talk about primary dementia. So type of primary dementia includes number one, Alzheimer disease. So this is the most common type of dementia. So two abnormal proteins, they build up in your brain, that is tau and amyloid protein. So what does these protein do? They disrupt the communication between the nerve cell in your brain. And nerve cells, they die, starting in one area and spreading as more nerve cells die in the other areas. So symptoms include like short-term memory loss, confusion, personality and behavior changes. Number two comes vascular dementia. So this is the second most common type of dementia and it is caused by conditions like strokes or arteriosclerosis, which block and damage the blood vessels in your brain. So symptoms include memory problems, confusion, trouble in concentrating and completing the task. Number three comes Lewy body dementia. So this condition, it involves the buildup of clumps of protein that are called Lewy bodies in your brain nerve cells. So these Lewy bodies, they basically damage the nerve cells. Symptoms include movement and balance problem, change in sleep patterns, memory loss, planning and problem solving difficulties, and visual hallucination and delusions. So about 5 to 10% of dementia are Lewy body dementia. Now let's talk about number four, that is frontotemporal dementia. Now this dementia, it results from damage to the frontal and temporal lobes of your brain. So the damage, it is caused by buildup of abnormal proteins in these areas. So it causes change in social behavior, personality, loss of language skill like speaking, understanding or forgetting the meaning of common words, or motor coordination. And last comes mixed dementia. So this is a combination of two or more dementia. So the most common combination is Alzheimer disease with vascular dementia. So it's most common in people of 80 of age and over. So this is, we have discussed primary dementia. Now let's discuss the secondary dementia due to other disease and conditions. So here number one comes Huntington disease. So a single defective gene caused this brain disorder and the disease caused a breakdown in your brain nerve cells which cause body movement control problem as well as thinking, decision making and memory trouble and personality changes. Number two, we'll talk about Parkinson's disease. Now many people in the later stages of Parkinson's disease, they develop dementia. Symptoms include like trouble in thinking, memory, hallucination, delusions, depression, trouble with speech. Number 3 comes Creutzfeldt-Jakob disease. Now this rare infective brain disease, it affects about only 1 in million people. So an abnormal protein in your brain, which is called prions, cause the disease. So these prion clumps together and they cause nerve cell death in the brain. So symptoms here include problems with thinking, communication, planning or judgment, confusion, behavior changes, agitation and depression. Next comes Wernicke-Korsakoff syndrome. So this brain disorder is caused by severe thiamine, that is vitamin B1 deficiency. So this can result in bleeding in areas related to memory in your brain. So it's most commonly caused by alcohol use disorder but can also be due to malnutrition and chronic infection. So symptoms include double vision, loss of muscle coordination and difficulty processing information, learning new skills and remembering things. Last comes traumatic brain injury. Repeated blow to your head can cause this injury. So it's most often seen in football players, boxers, soldiers and people who've had a vehicle accident. So dementia symptoms which appear years later include memory loss, behavior or mood changes, slurred and speech and headaches. Let's talk about number 3 and that is dementia due to reversible causes. So here we'll first talk about normal pressure hydrocephalus. So this condition happens when cerebrospinal fluid builds up in the brain spaces. So the excess buildup arms your brain. So normal pressure hydrocephalus, it can be caused by brain infection, brain injury, brain bleed or previous brain injury. So here symptoms include poor balance, forgetfulness, trouble paying attention, mood swings, frequent falls and loss of bladder. Number 2 comes vitamin deficiency. So not getting enough vitamin B1, B6, B12, copper and vitamin E in your diet can cause dementia-like symptoms. Next comes infections. So infection that can cause dementia-like symptoms include HIV infection, syphilis and Lyme disease. So symptoms reported with COVID-19 infection include brain fog and acute delirium. Next comes metabolic and endocrine condition. So conditions that can mimic dementia include Addison disease, Cushing disease, low blood sugar, exposure to heavy metals like arsenic or mercury, high calcium levels like hypocalcemia, other often due to hyperparathyroidism, liver cirrhosis and thyroid problems. Then comes medication effects. So some medication in some people can mimic dementia symptoms. That includes pills, anti-anxiety drugs, antidepressant, anti-seizure drugs, etc. Other causes of dementia like symptoms include brain tumor and subdural hematomas, that is brain bleeds between your brain surface and covering over your brain. So till now we have discussed about what is dementia and types of dementia. Now let's talk about symptoms. So early symptoms of dementia include forgetting recent events or information, repeating comments or questions over a very short period, misplacing commonly used items or placing them in unusual spots, not knowing the season, year or month, having difficulty coming up with right words, and experiencing a change in mood, behavior or interest. Now signs that dementia is getting worse. It includes your ability to remember and make decisions further declines. Talking and finding the right words become more difficult. Daily complex tasks such as brushing your teeth, making a cup of coffee, working on TV remote, cooking and paying bills become more challenging. Sleeping pattern changes, increase or worsening of anxiety, frustration, confusion, suspiciousness, sadness or depression. Needing more help with activities of daily living such as grooming, toileting, bathing and eating. So these symptoms are general symptoms of dementia. Each person diagnosed with dementia has different symptoms. So depending on what area of the brain is damaged. Additional symptoms or unique symptoms occur with specific types of dementia. Now let's discuss the causes. So dementia is caused by damage of your brain. Dementia affects your brain nerve cells which destroy your brain ability to communicate and its various areas. It also results from blocked blood flow to your brain, deriving it of needed oxygen and nutrients. So without oxygen and nutrients, brain tissue die. Damage to your brain result in different symptoms depending on the area of your brain affected. Some dementias, they aren't reversible and will worsen over time. Another group of health issues can result in dementia-like symptoms. Many of these conditions are treatable and dementia symptoms are reversible. So we have discussed the symptoms and causes. Now let's talk about diagnosis and test. So how is dementia diagnosed? Confirming a diagnosis of dementia can be difficult. Many diseases and conditions they cause or they lead to dementia. So in addition, many of the symptoms are common to many other illnesses. So your healthcare professional will ask the course of your symptoms, ask about the medical history, review your current medications, ask about your family history of diseases that include dementia, and this may also order tests including laboratory test, imaging test and neurocognitive test, which is basically a thinking test. So neurologists and geriatricians may assist in making diagnosis of dementia. So first comes laboratory test. So what happens in laboratory test? It rules out other disease and condition as the cause of dementia, such as infection, inflammation, underactive thyroid and vitamin deficiency, especially B12. So sometimes healthcare professionals order cerebrospinal fluid test to evaluate the autoimmune condition and neurodegenerative disease if warranted. Number 2 comes imaging test. So your healthcare professional may order the following imaging test of your brain. So number 1 comes CT, that is computed topography and magnetic resonance imaging, that is CT scan and MRI. So CT uses X-ray and computer to show the detailed image of your brain, and MRI it uses magnets, radio frequencies and other computer to create detailed image of your brain. So these imaging tests, they look for evidence of stroke, bleeding, tumors and fluid on your brain. Number 2 comes FDG PET scan. So it is a special type of brain scan that aids in determining the brain function and cognitive decline by pattern of how a type of glucose is absorbed by brain tissue and is sometimes needed in specific diagnosis. Next comes neurocognitive testing. Now during neurocognitive testing, your healthcare professional uses written and computerized tests to evaluate your mental abilities. That includes problem solving, learning, judgment, memory, planning, reasoning and language. Now let's talk about management and treatment. So is dementia treatable? First, it's important to understand the term treatable, reversible and curable. So almost all forms of dementia are treatable. In that, medication and other measures can help manage your symptoms. However, most types of dementia can't be cured or reversed, and treatments provide only modest benefits. So fortunately, some types of dementia like those brought on by treatable causes may be successfully reversed. These dementia like symptoms are caused by side effects of medications, drugs or alcohol, tumors that can be removed, subdural hematoma, which means a buildup of blood beneath the outer covering of your brain that's caused by a head injury, normal pressure hydrocephalus, which is buildup of cerebrospinal fluid in your brain, metabolic disorders such as vitamin B12 deficiency, hypothyroidism or hypoglycemia. Depression. So dementia that aren't reversible may still partially respond to medication that treat memory loss or behavior problems. So these dementia, they include Alzheimer disease, vascular dementia, dementia associated with Parkinson disease and similar disorders, AIDS dementia complex and Creutzfeldt-Jakob disease. Now let's talk about what medications are available to manage dementia. So drugs approved for the most common form of dementia, that is Alzheimer disease, includes cholinesterase inhibitor, which includes donepezil, rivastigmine and galantamine, NMDA receptor antagonist memantine, that is Dementia, and anti-amyloid antibody educanum. So healthcare providers use these drugs to treat people with some of the other forms of dementia. So if we talk about cholinesterase inhibitor and NMDA receptor antagonist, they affect different chemical processes in your brain. So both drug classes, they have been shown to provide some benefit in improving or stabilizing the memory function in some people with dementia. Cholinesterase inhibitor, they manage the chemicals in your brain that allow the message to be sent between brain cell, which is needed for proper brain function. Memantamine works similarly to cholinesterase inhibitor, except it works on a different chemical messenger and helps the nerve cells survive long. Although none of these drugs appear to stop the progressiveness of the underlying disease, they may slow it down. If other medical conditions are causing dementia or coexist with dementia, healthcare professionals prescribe the appropriate drug used to treat those specific conditions. So these other conditions include sleeping problems, depression, hallucination and agitation. Now, can dementia be prevented? Although dementia can't be prevented, but living a health-focused life might reduce the risk factors of certain types of dementia. So keeping blood vessels clear of cholesterol buildup, maintaining normal blood pressure, maintaining healthy blood sugar level, staying a healthy weight, basically staying as healthy as you can keep your brain fueled with oxygen and nutrients. It needs to function at its highest possible level. So specific healthful steps that you can take to involve stop smoking, follow a Mediterranean diet, which is one filled with whole grains, vegetables, fruits, fish, nuts, beans, olive oil, and only limited amount of red meat. Exercise. Give at least 30 minutes of exercise most days of the week. Keep your brain engaged, solve puzzles, play word games, and try other mental stimulating activities. So these activities may delay the start of dementia. Stay socially active, interact with people, discuss current events, and keep your mind, heart, and soul engaged. So in conclusion, thank you for watching and joining us on this important journey through the world of dementia. It's a challenging road, but remember, knowledge, empathy, and support can make all the difference. If you found this video informative or helpful, please give it a thumbs up and consider it with others. Together we can raise awareness and offer support to those affected by dementia. And don't forget to subscribe and hit the notification bell for more valuable content on this topic and other related health and well-being. We are here to help you on your journey. Thank you for watching.